The objective of the Adolescent 360 Mid-Project Dissemination Meeting is to highlight the meaningful adolescent and youth engagement strategies that generate health and development outcomes, among others.
One of the most important projects we have is the Adolescent 360 project, and the project has commenced implementation in Kano in 2021, basically to support breaking the barriers that limits the especially married adolescents from accessing healthcare services, especially sexual reproductive health services. If you look at the data from Kano, and you look at most of the maternal and perinatal death surveillance review that is done by the state, that is led by the State Ministry of Health, you look at the figures of mortality, you see the highest population that you have high mortality among them are normally married adolescents. And this is simply because most of them are not well equipped and not prepared to understand the challenges around pregnancy and childbirth. And so the A360 project work with this population in order to empower them to access contraception and be able to space childbirth, so that between one child birth to another, they will be adequately prepared, both psychologically and physically and physiologically, to be able to conceive and have very safe pregnancy.
236 healthcare providers have been trained to provide adolescent-friendly health service across 231 primary healthcare centers in 31 local government areas of Kano State.
Well, actually, the adolescents aged 15 to 19 years constitute a very significant part of our population of the youth, and they are very significant in terms of whatever a nation want to achieve for national building. And it is true that this population is not really prominent in terms of access to healthcare services, especially reproductive health. From this gathering, the organizers are making government to be more aware on the need, and they have been supporting Kano State government to increase the visibility of this age group in terms of access to critical reproductive health services, especially services around maternal and child health, knowing that the maternal mortality, if you segregate it into age groups, this group constitutes a larger percentage of women who die as a result of childbirth and pregnancy.
A 360 Amplify project is a 5-year project 2021 to 2025 implemented by Society for Family Health. Muhammad Adamu, AIT News, Kano.